Lauren Hagerman, and today I'm going to be talking about if ovarectomies are a solution to improve behavioral issues and moodiness and aggression within mares. So, although there's a multitude of reasons that these issues could be caused, whether that goes back to genetics or an issue or a hole in your training, a lot of these cases can be traced back to hormonal estrus symptoms or occasionally ovarian neoplasia or ovarian cancer. The most common form of this ovarian cancer would be granulosa which are tumors that actually inhibit testosterone, causing stallion-like behavior of these mares and a lot of times aggression. So even if these horses are usually very trained and very level-headed, and they all of a sudden, it usually happens around age 12, they all of a sudden start to become aggressive and, towards other horses, towards either their owner or their handler. Sometimes these GTC tumors can be the cause. So in this study that I'm going to be going over today, it goes between two different groups of horses. So there's 28 mares in total. 14 of these mares have an ovarian tumor to some sort. The majority of them have GTC or granulosa tumors. Some of them have other smooth muscle or more benign smaller tumors. And then 14 of these horses have no tumors or cancerous things at all in their ovary. So all of these horses were previously health screened. They were tested to make sure that there was no musculoskeletal pains, ulcers, any other pains that could be the root of these behavioral issues. They were all warm bloods, and they were all with pretty much clean medical bills before these pains and issues came up. So there was a study done in 2007 that kind of prompted this study that showed an 83% improvement in behavior and an 86% improvement in aggression of horses after an ovarectomy. So before these horses had the procedure, they were rated on a quantitative scale of 1 to 10 on their rideability and a quantitative scale of 1 to 10 on their on-ground behavioral skills prior to the operation, and then they were rated again after this operation. So there was a pretty good improvement significantly in both groups in rideability and behavior on the ground for both studies. So for the control group of mares, the mares that did not have any cancer present, they were rated a 1.7, from 1 being the worst and 10 being the best on both scales. They were a 1.7 before the operation, and then they were a 7.4 after the operation. And the cancerous group of males went from a 2.9 to a 7.0 on the rideability scale post-operation. So there were significant improvements seen in both groups of mares, but there wasn't really much improvement, or there was, but there wasn't really much of a significant difference between the cancerous mares and the benign mares. It kind of just showed improvement overall once these ovaries were removed. So it was kind of hard to conclude in this experiment if this was due to the granulosa tumors or if this was just due to the hormones of their estrous cycle and symptoms that could be related to the estrous cycle. So in the future, this study could really be improved by using a larger study group of mares and a more scientific approach to determine the differences of these mares pre and post operation, aside from just rating on behavioral and rideability skills. Thank you.